Welcome to the Children and Young People's Directorate Award. The shortlisted teams for this category are the CAMHS Crisis and DBT team. This team covers A&E departments across our boroughs. The Greenwich Health Visiting and Central Admin team, working with young families in the borough. And our Children's Community Nursing team, working with children with special health needs. The Service Director and Judging Panel member, Lisa Thompson, told us about the panel's decision process.
We had a very difficult task on our hand because we had 27 nominations and they were such a high quality. I'm really pleased to say that there was consensus in our decision making, which was reassuring for all. But as I say, it was a very, very difficult task. The nominations were of a high quality. If we could, we would have awarded every Team of the Year award, because I think for Children and Young People's Directorate, the teams have been fantastic this year, and I'd like to thank them all for their hard work and commitment to delivering services for the Trust.
Thank you, Lisa, for explaining how you managed to get 27 nominations down to a short list of 3. Not easy. For this award, it has already been mentioned how difficult the final decision was, and so we have joint winners. The first winner is the Children's Community Nursing team. Throughout the pandemic, the team have remained flexible, adaptable, and embraced the changes that have been needed. Despite many teams being able to work from home, this service still required essential face-to-face visits, seeing up to 120 children in a week. The team support local and tertiary hospitals by reviewing children that would normally receive care in hospital to prevent them missing out on care, and also to support with shielding. 2 team members were redeployed to the Demelza hospice, and the team has supported the local hospital by carrying out weekly COVID swabs on the children with sickle cell requiring hospital attendance for blood transfusions. The team has also supported staff antibody blood testing. This was a huge initiative, and the nurses, healthcare assistants and nursery nurses ran many clinics on different sites. Matthew was waiting for them at Acorns, Queen Mary's, to break the news to them, and here's what happened.
You're the Children's Community Nursing team, yeah? That's right. Okay, right, we're here at Acorns and Queen Mary's Civic Cup with the Children's Community Nursing team. So we've heard a lot about the work you've been doing during the pandemic to support children and families throughout the year, and we're here today because you've received a number of nominations for the Children and Young Persons Team of the Year award from a lot of your colleagues and from people across the Trust. And we can't have the kind of event where we all get together this year, so I'm here to tell you today that you're the winners. So, congratulations.
It has been a really tough year. I think you've just said it all. I think the team are amazing. They come together, whatever's thrown at them, and take everything on. They're a yes team, so if we say, can you do this? Everyone's like, yes, how are we going to do it? How are we going to get on and get this done? But it's been challenging, but we've all looked after each other.
We had a lot of children there that really needed us, and we did do our best. And I was glad to be there to help.
Well, I think we're just bracing ourselves really, and just being prepared for, what's going to be thrown at us really. So, yeah.
And I think it's one of those years where you realise the importance of having really good colleagues and people around you who can look after one another.
Yeah,
so,
it is. Yeah.
So look, for the next 12 months, you're Children and Young People's Team of the Year. Thank you very much on behalf of Oxley's and all the families you're looking after, and well done again.
So the Children's Community Nursing team are fantastic winners for the care that they've provided for children and young people in our communities with more complex health needs. The care that they've provided throughout the year has been outstanding. Particularly during the pandemic, they took on extra responsibilities by supporting our staffing groups with the swabbing, and continue to do that with the flu vaccinations. And really importantly, for the children with the complex health needs in hospital, they worked in partnership with Demelza hospice to support those children to come out of the hospital quicker, that they're able to be then looked after in the community, in their local setting with their families. to really help them during that difficult time.
Congratulations to everyone, and we hope to see your smiling faces again without the mask very soon. The second winner of the Children's Award is the CAMHS Crisis and DBT teams. They have gone above and beyond to support young people and families, both before and during the COVID-19 period. The crisis team continued to cover A&Es across the borough during the lockdown to assess and support young people who had presented due to mental health needs. They had to adapt to the changing demands, including moving to working largely out of hours to enable other boroughs to cover the day shifts when needed. Thanks to their dedication and hard work, young people continue to be provided with high quality and timely crisis assessments. The DBT team offers an intensive evidence-based intervention for young people presenting with emotion, dysregulation and self-harm and suicidal behaviours. Within 2 weeks of lockdown starting, the service had adapted to continue to provide all aspects of the intensive intervention virtually. This included weekly individual sessions, weekly group sessions for parents and young people, and 9 to 5 phone support for parents and young people. Due to the motivation and commitment of the team, parents and young people have continued to provide positive feedback regarding the support they have received, and no young people engaging in this service during this time required inpatient admission. With a lot of the team working both remotely and in different locations, we had to get creative to give them their surprise. We managed to join their Monday morning Teams meeting undetected, where Deputy Medical Director Abby Fadipi also jumped on the call to make the announcement. Here's how it went.
Around we're a new pathway and we're new teams, and how much is out there about our services.
Hi Mariam, how are you? Can I interrupt your meeting if you don't mind?
Yeah.
Hi everyone. Whoever doesn't know me, I'm Abby Fadipa. I'm Deputy Medical Director, and I've been asked to present you with the Children and Young People team of the Directorate. So congratulations to all of you. I hope you can see it. I'm trying as much as possible to show it to you.
We can't see. What is it? It says congratulations.
Guys. It's a recognition award to your team for all the work that you've done this year. I was told that there were 26 nominations and your team won. You were described as being able to overcome all the challenges associated with COVID, and you carried out your work with smiles on your faces and made sure that you kept the well-being of young children, which you look after. That was what was paramount for all of you. So congratulations.
Can I just say what the award is? The DBT and the crisis team are the joint winners of the Children and Young People's Team of the Year. It's a joint win with another team in the service that we don't know, and it's going to be filmed and announced on the 6th of November, but the joint winners of the Team of the Year. And I've got here some party poppers just to really... Didn't know. Here's another one. Go on then.
We chose the CAMHS Crisis and DBT team because they stood out for us for providing really great out-of-hospital care for children and young people. Their work involves a lot of partnership working, which really struck us. And it stands out, their work, for the outcomes that they've achieved, drastically reducing CAMHS inpatient admissions. And this was carried on being achieved during the pandemic, where there have been additional challenges for the team due to working on the front line in hospitals, which the team have adapted to successfully.
Thank you, Abby, and everyone involved for putting that together. That leaves us to say a special thank you to our highly commended team, the Greenwich Health Visiting and Central Admin team, who throughout a year that has been incredibly uncertain and challenging for the Greenwich Health Visiting team and Central Admin team, their commitment, hard work, perseverance and dedication to providing an excellent health visiting service to the families of Greenwich hasn't wavered. Even before the COVID-19 pandemic, changes in commissioning had caused uncertainty. Then the COVID-19 pandemic plunged the whole service into a situation where new ways of working had to be introduced swiftly. The teams continued to work to a very high standard, meeting the increased demands placed upon them, responding to the challenges of finding new ways to work, and accepting the frequent changes that were asked of them without complaint. With everyone working together, supporting each other and adapting to the frequent changes that have been necessary, young families of Greenwich continue to receive the best care and support possible. Congratulations and a big thank you to you all.